Rectal prolapse is a problem where the rectum is turning inside out on itself and coming outside the body. Most of my patients feel like there's something hanging out, or they might think that they have had a bad case of hemorrhoids or that there's extra tissue where it shouldn't be. Some people even feel like they're sitting on a ball or a lump of tissue. Many patients with rectal prolapse may also experience problems with bleeding, mucus leakage or drainage, incontinence, or the difficulty in controlling gas, liquid, or solid stool, as well as troubles with constipation or difficulty in being able to have a bowel movement. Typically, the problem isn't painful, although some patients do experience mild discomfort. The prolapse will oftentimes be able to go back up inside on its own, but occasionally patients need to manually reduce or push the tissue back up inside. There are many treatment options available for rectal prolapse. Some of my patients ask me if they have to have something done for the prolapse, and the answer is no. It's generally not a life-threatening condition and doesn't cause cancer, but the goal is to relieve symptoms. And without doing something for the prolapse, it will usually get worse over time. There are two major surgical approaches for fixing rectal prolapse. The first involves a method through the belly, where we bring up the prolapse and help fix the rectum in place. This fixation can be done using either sutures or a mesh. And sometimes if there's an excess amount of colon, surgeons will remove that extra segment of tissue and reconnect it. The second approach involves going from the bottom, or a perineal approach. And what we do here is remove the excess segment that's out and then reconnect the intestine. The choice of which type of surgery to do for rectal prolapse really depends on the patient's preferences and overall condition. When we fix the prolapse through the belly, there's a slightly lower recurrence rate or chance that the prolapse will come back, but the risks that go along with that surgery can be higher. When we fix the prolapse through the bottom, that approach usually has lower risks associated with it, but higher chance that the prolapse could come back.
Go ahead.
Recovery after rectal prolapse surgery is usually good, no matter which approach. However, when the abdominal or belly approach is used, recovery is typically slightly longer, especially if one single incision is used to repair the prolapse. Another approach through the belly involves using laparoscopy or a camera and smaller incisions to fix the prolapse, and the recovery with this may be shorter. When we fix the prolapse from the perineal side or through the bottom, typically it's a 1 to 2 day hospital stay with faster recovery at home. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. They have completed advanced surgical training in the treatment of these diseases, as well as full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery, and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. They are well-versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening examinations and surgically treat conditions if indicated to do so.